Alrighty, well, hi everyone. Welcome to VetRec. I'm Dr. Kyle, and today I'm going to be showing you how to use our records recap feature within the platform. What you're going to want to do is you start here on the same landing page you get to every time. If you make this bar go out here, you can see there's a nice little records recap button. We're going to go ahead and click that. And today we're going to do some records recap for our friend Benny, and I'm going to explain this to you as we do it. So we're going to look up Benny here, get some medical records, and we will start and summarize the visit. So what is this doing? What are we doing here when we're doing a records recap? So let's say Benny came from a separate vet clinic, has a whole host of records that we need to process. This is a way for us to upload a PDF without technicians, veterinarians, CSRs, receptionists having to scan through each individual thing that's been done and hopefully getting it right when you integrate it with your PIM software. So this is a quick way to go through otherwise lengthy records, and that way we can get the best plan of attack for this patient and understand the full history. Other things that I'm going to show you throughout this process, and this will be utilized here in a bit, is our D.A.V.I.D function when we have records recap. I find this to be very useful in my day-to-day practice, as sometimes some of your patients have very long records and you still need to search for things even after they're summarized. So seeing this here, this is D.A.V.I.D more in line. What he does is he can pull from your records recap all of your records and answer questions. And I'm going to do that for y'all once this is loaded. And Benny's case was a pretty lengthy record, so it does take some time for it to load. It can take 30 seconds, a minute, it depends. Sometimes you have a patient and they're a puppy that just transferred. Other times you have a Frenchie that's had 13 years worth of skin issues, so you have a very robust thesaurus of their history. Now, what you're going to see here to start out with is our summary, right? So it gives you a summary of who the patient is, chronic issues, we have Lyme disease, current medications have been on, antibiotics, appetite stimulants, vaccination statuses, and treatments. What this does is it just gives you a nice summary of everything that's listed before, and then as you go down, you can see who they were referred to by, the doctors, the clinics, the dates that this happened, the prior issues like aspiration pneumonia, tongue laceration, prior vaccines. Again, everything you need to know is right here. What we're going to do now is we're going to use the D.A.V.I.D function. So the D.A.V.I.D function here, and this is, we'll keep it nice and easy, last vaccines given. So what it's going to do, it's going to pull from that medical record and let you know when the last vaccines were given. And again, this is quite helpful for when you get those patients that come in and you just need to know what to do on them next, right? Sometimes they're coming from out of state and the medical records are all over the place and it says rabies vaccine in 3 different areas, and this is a good way to hone it in. So if you want to start a new chat, we go here and let's ask it a little bit more involved question, right? When was anyone diagnosed with Lyme disease? And what's this going to do? It's going to read from the notes. It's going to say that we were seropositive on December 18th, 2024 from a 40X. This is great. So again, this is our records recap feature. If you guys have any questions, let us know. Hope you enjoyed as much as I do.